Do you have uneven bench press? And why? Just came to me with pain in between her scapula when internally rotating her arm. This is a repetitive movement she completes with her job mainly every day. She also trains at the gym and found sufficient difference when overhead pressing, saying she feels one arm is weaker and is a little bit left behind. As you can see, while you complete bench press, there are several muscles involved. However, the stabilizer muscles includes the core muscles and the rotator cuff. This is why sometimes the reason of an uneven bench press can be poor movement mechanic, lack of control over the scapular stability while bench press or overhead pressing, or weakness in pecs, triceps and shoulder in one on the side. However, when assessing, you need to close out mobility and stability problems. This is why we have completed a few of these assessments. The lower traps play a key role in stabilizing and repressing your shoulder joint during bench press, overhead presses, or pull-ups as few examples. If your lower traps are too weak, you may have difficult time lifting overhead. This is why I have got her to complete pull-ups, rows, and overhead lifts as part of our assessment, but also tested her for mid and the low trap and rhomboid weakness, where we have found sufficient weakness on the right side. Your low and mid traps and rhomboids are muscles in your upper back that are responsible for scapular retraction and depression, so strengthening those muscles will be part of a good rehab program. What other movements you need to look out for? While completing this test, you found that your head wants to push off forward, lower back overextending, and the arms trying to turn out, all sides of his restricted latissimus dorsi. This can affect your overhead mobility. Also can pull your shoulders forward into a rounded position, shortening and making your pecs tight, and also can lead to compressing forces on your lower back. Take it that way you can have lower back and shoulder pain from tight latissimus dorsi. So we're looking for external rotation. Sufficient external rotation in the shoulders helps to keep it healthy and also responsible for overhead movement. Decreased thoracic mobility decreases the range of shoulder movement, especially lifting above the head. When assessing overhead movement, you also want to watch out for scapular rotation and movement. The scapula should rotate out around 60 degrees. If it's failing to do so, it can result in uneven bar. It's a symptom of lack of scapular rotation that shoulder raises higher. Have a look of any overactive tight muscles like the levator scapula, the neck muscle, and the upper traps, because this might need soft tissue release regularly. If you have sensitive shoulders, try to avoid dropping the bar under that 90 degrees. Just keep the upper arm parallel to the floor. Hope this helped, and I'll see you back with another video.